I'm a consultant gastroenterologist and hepatologist at Apollo Hospitals, Hyderabad. So today we'll be trying to bust a few myths and talk about a few facts about alcoholism, alcoholic liver disease, and how to manage alcoholic liver disease. Alcohol, like several other drugs that are used out there, can cause serious damage to the body, to several organs of the body. It can cause acute and chronic changes to different organs of the body. So I would definitely say alcohol is equally as dangerous as any other drug that is available out there. Alcohol abuse and alcohol addiction are two separate entities. Alcohol abuse can be anyone who overuses alcohol, can be a binge drink, or someone who has frequent falls or frequent fractures or other end organ damage from these can happen from alcohol abuse. Alcohol addiction, on the other way, can be a separate entity. Someone who cannot stay without alcohol use, someone who needs alcohol on a regular basis. That's what alcohol addiction can be. Not always is alcohol use leading to alcohol addiction. Again, it comes down to the person who starts drinking alcohol. If their mindset is such where they become dependent on alcohol, it can lead to alcohol addiction. But not always does alcohol lead to addiction, and there are some people who have social alcohol use. Not always do they get addicted to alcohol use. So when it comes to the question about who is at risk for developing alcoholic liver disease, everyone has a different threshold. There are several criteria that we look at, or everyone differently behaves to alcohol and the effects of alcohol. The age of the person, the sex of the person, the other comorbid illnesses that they have, coexistent liver disease, the nutritional status, the hydration status, the other medications that they take, and certain enzyme deficiencies, certain genetic factors also play a big role. So some people ask this question, I drink very less, why did I get liver disease? I don't drink too much, why did I get liver disease? So there are several factors that determine whether you are prone to chronic liver disease or serious liver damage. So not everyone responds the same to the same amount of alcohol use. It's definitely a myth that coffee can replace alcohol use. Coffee by itself has a lot of side effects. Anything in excess can have its own effects. Coffee can cause palpitations. Coffee can make you give the jitters. Coffee can be a diuretic. It can dehydrate you more and more. So coffee definitely cannot replace alcohol. Coffee has its own uses. But if you do it more than the required amount, it can have its own effects. This can be a myth and a fact. If the patient who is addicted to alcohol or who abuses alcohol is not interested to seek help, no matter what you do, you cannot help that patient. But if that patient actually, in fact, is very motivated to get himself treated for the alcohol-related damage, there are several treatments available. There are several options available, but it definitely requires the patient's patient needs to come forward to seek help and needs to be motivated to quit or get himself treated for alcohol abuse and addiction. That is a fact. Alcohol can affect any organ in your body. Alcohol probably is one of the most common causes of death throughout the world. There are several studies that show that 1 in 5 deaths in the new age have been attributed to alcohol use. Alcohol can severely damage your liver. It can lead to fatty liver. It can cause a spectrum of diseases from fatty liver, steatohepatitis, fibrosis, liver cirrhosis, and the dreaded liver cancer. So alcohol does cause effects in several organs of your body. You need to watch out for it. That is a myth because there is treatment available. Depending on the spectrum where the person's liver disease lies, the treatment varies. For simple fatty liver, just quitting alcohol, making some lifestyle and dietary modifications, and certain medications can help immensely. Once you develop advanced fibrosis, you may need some other medications to reverse the fibrosis. Once you develop liver cirrhosis, then we need to start working on some medications to prevent complications from the cirrhosis and developing hepatocellular cancer. So there is treatment available for alcohol-related liver injury. It all depends on which stage or which part of the spectrum you lie. This definitely is a myth. When you confront a person who is an alcohol user or abuser, it definitely will not help the situation. You need to motivate them, you need to make them understand the effects of alcohol, you need to make them understand the complications that can happen, what are the deleterious effects that alcohol can do to the body, and try to convince them to scale back or get rid of the habit of abusing or getting addicted to alcohol. So we tried to talk about a few myths and facts about alcohol use. I would like to conclude by saying anything in moderation is a good thing. Social alcohol use is where you need to stop it. Do not get addicted to alcohol. Do not try to abuse alcohol. In moderation should be fine.